All right, welcome back. We're at our next iteration of Culture Chats. You're here with Andy and Rachel, and today we are joined by Todd Shields. He's the Vice President of Operations for St. Charles. Todd has been a resident of Central Oregon since 1997 and has served in multiple leadership roles within the St. Charles Health System for the past 17 years. So thanks for joining us, Todd. Always happy to have new guests here, new perspectives. Today, we wanted to really talk to you about having a culture of problem solvers, how you're enabling folks at the front line, super important in the healthcare arena with people who are meeting patients right where they're at. So we just wanted to talk to you, hear what you do, hear what's been challenging. But maybe we could just start with what's working for you. What's the process? What does that look like?
Great. Well, thanks for having me. I appreciate it. Love to share the opportunities and the work that we do here at St. Charles. So, going on my almost 27th year here. And why I tell that is because I've been in a multitude of different roles, like you had mentioned. But I actually started as a frontline radiology transporter and then worked my way over the years. Ultimately, now I'm the hospital administrator for both the Prineville and Madras critical access hospitals. So, I like to tell the story because I think it's really important with that background of where I was to where I've been and the importance of building those relationships and being able to tell a story. So you're going to find I'm a relationship based leader. That is what I really focus on. And I believe that is what's important as we help to build a culture of safety and then a culture of problem solving. So we've implemented multiple different tools and techniques throughout the health system. And I feel very fortunate to get to trial many of them first in the critical access hospitals. So in Madras and Prineville, because we're smaller and you can influence and you can build relationships different in that type of setting. So really feel great opportunity to do that.
Yeah. So when you talk about critical access and like having, this is folks that are out in rural areas, this is their first stop. Is that what you mean by that?
Yep. So a critical access hospital is a facility that has less than 25 inpatient hospital beds. It's a red
Gotcha.
world designation in the world of hospitals. So we, can't do everything. We do
Mhm.
provide emergency medicine. We provide imaging. We provide inpatient stay. We provide laboratory services, and then usually an outpatient clinic and
Mhm.
surgery as well. But if we need to move to a higher level of care, we transfer our patients, usually for us then, to St. Charles in Bend, which is our tertiary
Mhm.
facility.
Yeah, I think you were about to get into sort of some of the tools and things that you're using across the organization. And I have to note, I love in the background that you've got what looks like not a journey map, but like
Yep,
a Kanban board, right? Where it's
definitely.
sort of working out. Is that one of the tools you all are using as part of your problem solving?
So one of the things I really like to start with and inspires me on a daily basis is around our mission, vision, and values of the organization. And I feel that it's important to understand what they are and how they influence your culture. So what I'm going to focus on here is I talk about our beliefs, and this is our beliefs as a health system, and they inspire me on a daily basis to serve, and they serve as a filter for decision making as we go through. One of the things here in St. Charles, again, is we believe it's our privilege to provide the best care for all. So, really important. And under that, then we're committed to deserving or being deserving of trust, and we're committed to constancy of purpose. And I say that constancy of purpose because that's what we're going to come back and talk to today as we talk about some of the tools that we have. We believe the work we do is greater than ourselves. So, we're committed to caring for the mind, body, and spirit of the whole person, and we're committed to excellence through continuous improvement. So you're starting to get a little bit of a theme here as we go through. We believe our strength is in our people. And this one is super important to me as I talked about the size of a critical access hospital and how we can connect differently. It's something that I'm passionate about. So we're committed to a lifelong partnership to invest and develop in our people. We're committed to treating each other with love, loyalty, and respect. And I believe as we move forward and we build a culture of safety, that is so important to have that relationship and then that trust and respect. And we believe we are at our best when we work as a team. So we're committed to team before self. So every day that I get up, this is what drives me to continue to come and do my job. And it helps to frame my decision making as we go through and make some really tough decisions at times as well.
Uh,
Just really quickly, I just wanted to comment on that really quickly because I think for a number of organizations, this is where things go awry, right? They spend a lot of time putting together this mission statement, this vision statement, and these values. And then as they get into the process, as the dog days start to come, as things get difficult, they forget to let that be their anchor. So it's really great to hear you. I mean, you cut me off and we're like, no, 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 we need to start back at the beginning, right? And that is 100% true. Anchor yourself back to those values because then decision making becomes easy but easier, right?
And I think that that's so important then for our frontline caregivers. So I want to do a call out. I'm going to reference to all of our employees as caregivers. That's how we do it here. So it doesn't matter if you're an administrator, if you're working in environmental services, or if you're a nurse or a doctor. We call everyone caregivers because we're all here providing an experience for our patients. And so again, it goes back to that belief that we work our best as we work as a team. So.
I love it.
It's interesting though. It is difficult. Again, I mentioned we have to make some pretty difficult decisions that maybe not everyone understands all of the background and the why. And maybe everyone doesn't agree with those, but it does make it easier if we can frame it around what we believe in and the choices that we've made, and then be able to have those communications and conversations directly with individuals that may be impacted.
yeah.
Yeah, I love it. Yeah, absolutely.
So
This is what we spend all day talking to folks about, right? Like get clear on your values, get clear on your beliefs, get clear on your why, and then it does make these decisions. And now we're just talking about the process. Now we're just figuring out how we do it. But then at least we all have a North Star, something to ground and circle around. So
exactly.
And if I could add, as an employee or as a caregiver, if that doesn't align with what you want to do in life, it makes their decision simple as well, right? Because if you don't align to these values, if you don't align to these core beliefs, this won't be a great place for you to work. So I think it also can help you figure out who are the right people to be part of the team, and maybe who do you have to help find something different for them.
Yeah, it's a great point, and I think that all starts at even as you're posting on your website to the first screening to the interview, and we focus on asking questions that do tie into our beliefs and our mission, vision, and values, and the why, because it's such a critical component of the work that we do.
Yeah. So
it's
can we
great.
talk a little bit about the problem solving element or aspect of the culture? How do you engage all the entire team in that process?
So we have a few things that we do throughout the health system, and again, it's more advanced in the critical access hospitals of Madras and Prineville right now as we've rolled it out. So we do daily management systems. So you'll hear me reference that as DMS as well, and talking about some of the tools that we do. So um, the tools that we have implemented within a daily management system has been, we do the most important thing I think that we have added in my tenure here is our daily performance huddles. So these huddles give us
You've
a really.
just made Andy like the happiest person ever. If all she ever wants to do is go around and implement huddles in every organization we talk to. So you've just made her week.
Well, perfect, because it's so important. I mean, and so I'll talk a little bit about our structures, and then I'll go to maybe some of the other tools. So we have implemented throughout the whole health system tiered huddles. And we have what we call a tier one huddle, which is in the department itself. So I'll use an example of maybe the emergency department. Then we've implemented a tier two huddle, which is a roll up from tier one as we're bigger and you have a director that maybe has multiple different areas. The tier one rolls to the tier two. A tier three is a facility based. So for me, I go from a tier one, which is a front line huddle at each department, to a tier three. And I have a combined tier three huddle for Prineville and Madras, since that's what our leadership structure is. And then from a tier three, we go to a tier four. And we do this Monday through Friday up to a tier four that elevates and escalates any barriers or challenges that we have in the moment and really focus on safety. I want to say something because I said we're not just a Monday through Friday organization. So different departments have implemented a day shift and a night shift, and then an escalation process. So if it's not a Monday through Friday to that tier 4, we have house supervisors or administrators on duty or duty administrator that things can still escalate up to. So the huddles are just a key piece of the work we do. And it sets the framework and expectation of what the day looks like. And so I'll kind of walk you through what one of our huddles starts as. We start with personal commitments at each of them. And so some people get frustrated with that, but we do it intentionally because it's our standard work. What we're trying to do is we're trying to role model and share the importance of standard work. So it may be we start and end on time. We solve problems, we escalate, but it's important for us to continue to say those so that we do set the expectation of standard work, especially as we're talking about some of the clinical work that we do. We then go down through our SMES section, so safety, methods, equipment, supplies, and staffing. So, and ask the question, I always say, do we have any new safety items today that may impact the safety of our caregivers and or patients? And then we walk through, do we have the equipment and supplies that we need to provide our best work today? And just kind of walk through each of those. And then it's also the opportunity if there is a new process in a method, or we have a new piece of equipment, or we have an identified safety risk. Those are the areas and at the time that we talk about those. So it's kind of a big area that we focus on, in that front line.
Yeah.
And then really asking if it's having to come onto the board, what is our communication back to close that loop? So loop closure is so critical. And one of the biggest gaps, and we're not there yet in what we need it to be for sure.
Okay.
We then move over into the middle section of a board, and this is more about problem solving. So instead of someone coming to the board and saying, I didn't get what I needed today with regards to a medication, it's okay, so let's write that out and say, maybe more into an SBAR. So I'm integrating a little bit of our teen steps into the program as well. And I can talk about teen steps in the future, but we want the caregivers at the front line to help solve the problem. And then we want it escalated up if it is not able to solve or if it's a super critical one, but really turning that back around. And it's not that you come to your leader and say, I'm having this problem today. It's maybe you're having a barrier. The leader and yourself should talk through what are those barriers. And then if the frontline caregiver can help them and move forward, they know how to do the work better than any of us as they provide that service on a daily basis.
That's right.
So that part is a middle. We have a little a pick sheet that people fill out. We do that just 3 times a week on Monday, Wednesday, Fridays in the middle section and do updates. And then moving over onto the right side of the board, it's information and announcements. So what new information and announcements do we have? And then the other thing that we've implemented throughout the health system is a huddle hot sheet. So that comes out on every Monday and it's aligned where it gives clear, consistent communication that everybody gets, as well as it's printed out and it's reinforced on the message or on the board itself. So I always ask, I'm sure that this is, as a leader, everyone has read it, is posting it and rounding and reinforcing the message. Those are kind of my standard terms as I go through my huddle.
Can we take that hot sheet? Can we start
I
using
know, I love that.
Huddle hot sheets
We
are
borrow that?
excellent.
Yeah.
They're excellent, very helpful.
Yeah.
Oh, that's
Um,
fantastic.
And we do an urgent in the know as well. So, and we call that, so if we need to communicate a critical issue that rolls up through our huddles, it's an urgent in the know that we send back to our caregivers to close the loop. And then we get down into who do we need to recognize today? So what great work is happening out there? So any kudos and acknowledgements, which is the best part for me, right? I love that. I love to hear the stories because I think that's an important part of how we all connect is the how and the why. So that's our
It
tier one.
reinforces that it's working too, right? These things,
Correct.
these things and these actions that we're doing are working. I love it. Can I ask you just a really quick question before you get into the other tiers? Because I think tiered huddles is one of the things where we do get a lot of pushback on. We don't have time. We have too much to do. And I'm like, but we do this in emergency rooms, which are chaotic at best. They're organized chaos, but they're chaotic at best. Tell me a little bit about how you guys were able to find the time to implement a tiered huddle system.
It was a struggle, and it wasn't easy, and it's still not easy in every area. But what I think is important is we have to make sure that it brings the value to the caregiver, because once the value is there, people will come, right? And it's their opportunity to have a voice and to share kind of the work that's happening. And I will say it doesn't happen every day, as we talk about the emergency room, if we have traumas come in or if we're really busy, but we'll try to move that huddle to a different time. And if that huddle doesn't happen, we still document on the board some information announcements for people to go by and read it. So it's just shifting your culture, but it's really leading by example. So it's not that I expect my leaders to do it. If I want them to see that I'm going to be there and participate as well. So that's a really important part of early implementation, is showing the value and learning from it. So as we do PDSAs, as we plan, do, study, act, we modify it again to bring that value to our frontline caregivers. So when people see me walk down at times, they'll say, "Oh, gosh, we're really busy, but I see you're here, so we're going to do huddle." And I will say, huddle's not for me. Huddle is for you. So don't do it on my account, because now that's not the culture that I want to drive. I want it to be.
It's not a checkbox.
That is correct.
Right.
Exactly.
Yeah. It's to add value. Thank you. Thank you for that. Because I think that people find that to be the biggest barrier. And in my experience, it's been, you're right, it really is difficult and challenging to get these things implemented. But the amount of time you actually save. So, how many fewer emails are you getting? How many fewer crises are you running into that's creating chaos in your organization? I think investing the time up front, it is a little bit painful, but the end result is it's spectacular. I mean, you end up saving more time than you realize.
Yeah, exactly. And I think what's another thing that came out of it, I just want to share, and it may feel like extra work for some individuals, but like the emergency departments in Prineville Madras, what they do is they actually then do a weekly update at the end of the week, and it takes information from the huddle board to share it, because we're 24/7 and trying to communicate consistently, and everyone communicates
Oh,
differently and learns
that's right.
differently. So some learn from being at the huddle board and talking and hearing that dialogue. Others maybe are working an off shift, and they then see the meeting or the minutes or notes that come out with that.
Love that.
So it
Love
really
that.
works well, because I said earlier, one of the things that makes it valuable is if you close the loop. There is no value if we don't close the loop. And I think we all really need
Amen.
to continue to acknowledge that as leaders, for sure.
Amen. 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 If I could sing, I would start
Yeah.
singing right now. Yeah, absolutely.
Nice. So I'll jump to a tier 3. So again, I go from 1 to 3, and I just want to say that the difference in that is a little bit higher level, and it's a bigger group. So it's all leaders that attend. And when I say high level, we don't get into the weeds as much unless we need to. So I've just redone our boards, and again, how we start is with our personal commitments. And then we move down into, are there any caregiver stories or safety stories that we want to share? So we always acknowledge and start there, and or good catches. So that's the big thing. So maybe somebody was going to give a medication and they realized the medication, during their checks was wrong. And we call that out, and then we celebrate that and we share it. So that's an important piece in calling that out. We then go down into days since our last True North Never event, and that means a reportable event in the health system. We know we try our hardest every day to help people coming into a hospital situation, but there's a lot of patient harm that actually happens in healthcare too. And how we can fix that is by being a culture of safety and giving everyone the tools to speak up when there is a potential harm that may occur. We then go down into our flow for the day. So, what is our capacity? What does it look like? How many surgeries? Do we have the ability to admit patients? And then we move down kind of into our safety methods, equipment, supplies, and staffing. But before we do that, the question is, have there been any safety events since our last huddle that we need to learn from? So maybe a patient fell. So any huddle or any potential harm that has happened within the last 24 hours is brought to that huddle. And then we talk about it and we share. So we have awareness. And then we go into our staffing. We go into information announcements. We go in then to ETO or vacation time off, who's on vacation, to make sure that one, you know who your resource is if someone's out. And then also, I think it's important to show that people do have a work-life balance, and I want to honor that. And I don't want people bothered, when they're off. So my ask is that they go back and look at that before they, pick up and make a phone call to someone's cell phone. From there, we also do our huddle hot sheet, and then we move into information announcements. And then again, who do we need to recognize today? And this is an important piece in recognizing. So any recognition, it's usually myself, the CNO, Shannon Edgar, and we write a note to them, a handwritten note, and then we deliver that to them. And then we ask, is there anything to go to tier 4 today? And then is there anything that comes back down from tier 4? So again, huddles go up, but huddles need to come back down. So those are kind of our platform, and it's pretty similar than tier 4. Actually, I want to
I
change
love
one
it.
thing. Oh, sorry.
Oh, okay. No,
Um,
you go, because I have like a series of questions for you.
So I wasn't getting enough action for barriers that people were escalating. So now we have, I've outlined it a little bit different. So I've outlined it where what are emergent issues that need to be addressed in the next 12 to 24 hours. And then from there into the next 7 days, 1 to 7 days. So 12 to 24, 1 to 7, and then 8 to 30, and then 30 on becomes a project. And we monitor them. And then we keep them on the board with status updates at the frequency we determine is appropriate. And then we move them over, and we do this all on OneNote. And then we move them over into a folder. And my goal is that I'll be able to pull all of those at the end of the year and do a summary of these are the things and actions that we have taken, because we hear you as a frontline caregiver, as we want to improve our culture and the work that we do.
Oh
So
my
again,
gosh.
loop closure.
Todd. So my first question really is around that tier 4 group, um, and where you started in terms of who's willing to share and how open are we in terms of maybe challenges that we've had, maybe mistakes that we've made, and where you got to today.
So I'll be transparent. Tier 1, 2, and 3 are really good. Tier 4, we have basically, and it'll actually start May 15th with a new format very similar to our tier 3, because I don't find that much value in tier 4 and others don't as well. And I can tell by the number of executives that don't attend anymore, right? And so
Oh, got it.
it's really just a report out, but I want to gain information that I need to take back to my teams as well. So we're
And you know what?
restructuring that.
I was actually talking about tier 3. I apologize. I was talking
Oh,
about your
oh,
huddle with your direct team. So at the beginning, when you started this tier 3 huddle, how open and willing were people to share everything versus where you are today?
It's been an evolution for sure. I would say that it's evolved where people are sharing more of the true challenges now, because we're trying to develop and build that culture where people can do their own problem solving and PDSAs. So the number of things that do get escalated actually are more complex now than what they
Mhm,
were. And I think that,
mhm.
it was, well, take this up to the huddle and they're going to fix it for us. Well, that's not what we want. We want our
That's right.
caregivers to have a voice at the table as we problem solve.
Yeah, I mean, this is one of the things I love, and I don't know if you can see the physical hearts like bouncing out of my eyes like in the cartoon. But this is really what we're trying to get people to kind of see and understand. So you have no idea how helpful these words are. And it starts where no one's raising their hand. Everybody comes to the huddle, or we used to do these big rounds where it was like the whole organization, all leadership was rounding. And at the beginning, no one's saying anything. Everyone's kind of like, "Oh, everything's good. It's good. We're good. Any problems? No, no, no." And then I love that you've switched it because you're like, we can't ask a binary question. I have to demand that there's an answer here, right? Like I have to open this up to ask, to demand an answer. And it's amazing as people don't get in trouble, as people are celebrated for these good, the good work, as people are celebrated for bringing bubbling things up. It's amazing how it opens the culture. And so in my experience, when we would go do rounds, for example, no one was afraid to say, "Hey, I was on, floor 2 and I saw a bed hanging out in the hallway." No one's ashamed to call that out, and the person who runs that floor is not ashamed to raise their hand and say, "Oh, I got that. I'm going to own that. I'm going to get that fit." And I'd love to sort of hear your perspective, but for me, it's amazing to see how open and how crazy that changes the culture, right? We start hearing things that we need to hear before they're these huge kind of big problems that now we've got to react to. We're just staying in this sort of proactive space.
Yeah, it's totally critical to do that. And I think that by having these huddles, it does change your culture for people's willingness to step up. But I also think it's because how we ask questions and how we present ourselves. So, it's asking instead of a yes or no question, it's the what or the how, or help me understand. So really focusing on those open-ended questions helps to drive and change that culture.
I wonder too if just the shift in fear, right? Like we see a lot of fear cultures, not just in hospitals, but all over. And when people bring up an issue, they're afraid they're going to be blamed. Or to the example you just gave, Andy, like, oh no, that bed was in the hallway. Ugh, I'm going to be in trouble. And to really just celebrate, flipping that and celebrating that. Thanks for bringing that up. More of that kind of. And once you start to see people not get in trouble, is that enough to change the culture? I don't know. And I also think too, like hospital environments or just all healthcare is a pretty litigious space that people do live in a little bit of a place of fear just by the nature of it. Like, does that have any impact or how do you think about that?
Yeah, again, I think it's relationship. I think it's how you present yourself at the Gemba. So Gemba is where the work is
Mhm.
done, right? And so for me, it's building those relationships, helping to share the success stories of people escalating concern, talking about safety as a priority. And then another thing that we've implemented, because it's hard, right? And we're 24/7. So definitely my take is if you're a hospital administrator or a leader in any way and you have a 24/7 facility, you need to know your day shift, you need to know your night shift, and you need to know your weekend caregivers. So I see too many people that don't do that. And that is a significant impact, on an us versus them or a cultural shift.
That's
And then,
right.
but what we did do is we implemented, it's called an ACT time. So it's our acts of excellence, accountability, caring, and teamwork. So we call it ACT time, and it's on Tuesdays and Thursdays from 9 to 11. And the expectation is that we don't have any meetings at that time. And we have our leaders going out, we have them building relationships, we have them closing the loop on things that are escalated, we have them problem solving with the team, we have them collaborating with, other departments during that time, because I was hearing too often, well, I can't find time, I can't do it. So, like, well, you better be out on the Gemba, you better be working with your colleagues and helping to drive that. And that is a time that you can do that work. So that is
I,
something
I,
that we have
Yeah.
worked on.
again, it's such a great example when you say I don't have time and your meeting is your calendar is stacked with meetings. It's usually meetings around trying to like react to all of the junk that's gone on versus if you standard work this where it's like these are blocked hours. Nobody gets to put anything in this time. And leader, you don't get to sit in your office. You get out on the floor. I love that you've made it interdisciplinary as well, right? So not just with your team, but with your colleagues, that you have to work with you. What's clashing here? And this is a perfect time to solve those things.
Yeah.
How quickly are you guys doing those? You know, um, I guess it's sort of these tests of change. How quickly do you normally like? Let's try this. How long do you wait before it's like, okay, it doesn't work. Let's revise. What's that process? Those quick
It really
tests.
varies in that whole, PDSA, plan, do, study, act. It's really dependent on what the issue is. We want to make sure we've had time to really study it and understand the pros and the cons, and not just be reactive to sale, or allow somebody to come in with a different perspective and change it immediately. We really need to understand and build countermeasures around each one of those and understand that, and then set the time in which we agree upon. If it's a huge safety issue, your timeline changes, right? And I shouldn't even say the word huge. If it's a safety issue, your timeline changes on how quickly you do that work. But I would say it's really dependent. And what I am finding is that's part of why we redid our tier 3 huddle from that, within 24 hours to the 1 to 7 days, because we weren't getting really clear follow up and loop closure or in that time frame, and needed a little bit more. And I felt like people were coming to the huddle feeling like, oh gosh, I'm not going to be able to report anything out. And I don't want us to always just say, okay, new update tomorrow, new update tomorrow. It's
Right.
what is the expectation and timeline that you're going to be able to come back with a thorough update for us as a group so that we're all on the same page.
Yeah, can I also add kudos to you, because a number of organizations, or a number of leaders, I'll say, sometimes struggle with we implemented this, especially if it's close to them. We implemented this, it's not working, but since I implemented it, we're doing it. But kudos to you, because I think this is a great point. As you implement new ideas, if it's not working, rethink how you don't have to scrap the whole thing, right? What are the parts that are working and what's not working? Adjust those. And I think it says a lot about you as an individual and your organization, because you've mentioned that a couple of times in this conversation, how something wasn't working and you just did a reset and tried something new.
Yeah. And how we did it is it wasn't me making a decision. It was going back to the team and saying what's working for you. Through the involvement of the huddle process and with regards to COVID, we used to do these only in person up through tier 4. So
Mhm.
up through tier 3, they were all in person, and then it went to tier 4, which became virtual as the system. Well, we went back to in person, but then the structure changed where the leadership team had both Prineville and Madras critical access hospitals. So doing 2 huddles, and people were having to jump on for 15 minutes for one huddle, 15 minutes for the next huddle. Mostly the same thing was said. So what
Mhm.
we did is we actually put out a little poll to say, what would you prefer? What would that look like? And ultimately, we went back now to a Teams meeting. We do it a little longer for 20 minutes now, usually get done in 15. One of the things that people miss, though, is that connection right afterwards and the grabbing each other at the huddle. But one of the things then, as a countermeasure, is that's when we then went and implemented our ACT time. So that accountability, caring, and teamwork as that opportunity then to drive some of that. So, but
So
it's a
smart.
great process.
How do
Yeah,
you
I mean,
share this with hospitals outside of your organization? Because this is
We partner with a
spectacular.
lot of different facilities, and we learn from other facilities too, right? So that's where we've learned it from over time, as we want to really develop that lean culture, continuous improvement, constancy of purpose. So again, going back to our beliefs and tying it in. And so some of the other tools I can share and talk about on the process is we also do stat sheets. So a stat sheet is a tool where I do it with my one up, and then I have a stat sheet with each of my leaders. And a stat sheet just really breaks it down into what our true north is. So, as we talk about experience and safety and quality and delivery and then, financial stewardship. So we ask open-ended questions in those, and I share what's interest to me. And that's how we guide our meetings. But then when I say interest to me, there's could be 20 things, but I always open with what do I need to know today? And what is your top priority to talk about? And they choose which domain then we talk about. And then I keep track and keep notes for each of the things we talked about. And we just do loop closure. Again, if you model it and you set that expectation, I think it then helps to drive it further down into the culture. So that's another tool. I do is stat sheets.
I love
We,
that.
we do scorecards. So each of our departments have scorecards that tie again into our True North measures and different domains. We used to do a monthly performance review then of each scorecard, but we have kind of set that aside, and we are doing it in a little bit different way now, and we're doing that through scorecards and then through our maybe nursing division meetings and or our ancillary and support meetings. Um,
Mhm.
I think leadership teams and leadership team meetings are critical. So I will say we have been able to decrease the number of leadership meetings based on the daily huddles, but I still would not get rid of them. There's still an opportunity to build
Yeah.
relationships and
Mhm.
work on something maybe a little bit deeper than in a 15 to 20 minute huddle. And then leader standard work is another important component that we have developed and built. And so many offices will even have a whiteboard. I'm not in my office today, but would have a whiteboard that it's, here's what you're going to do on a daily basis, and you mark it yes or no. Here's what you're going to do on a weekly or maybe a monthly. And then as I round or Shannon, the CNO rounds, we'll go into the office and maybe see, gosh, there were 3 days where you weren't able to do some safety checks because they were red. Tell me what your barrier is to that and what can we do to help? Because that is such a
Right.
priority. So
Right.
that's another tool. And visual management. I think visual management is such an important piece to the work we do, and to make sure that everyone understands the importance of that and the why.
Absolutely. Are you doing any digital visual management because of the changing dynamic of remote work?
We do some, but not to the level I think we need to be yet. So, and it is for some of the remote workers, but our scorecards or different things. It's an area of opportunity for us for sure. So those are the tools. Can I talk about one more tool that I love to do with rounding? So,
Please, I'm
so,
so
so
excited
that's where
over
I get my
here.
energy is by going out and building relationships and names and knowing people and knowing a story about them. So a couple ways that I do that is by one, just being present in the Gemba, making sure you're visible and people. I focus on names. I'm terrible with names, but it's critical that I try to remember everybody's name, and I have different ways of doing that. Everybody gets an anniversary card. Again, going back to the handwritten cards. So I do about 700 to 800 anniversary cards per year, and then just go deliver that to them kind of that week of their anniversary with a St. Charles pen. And it's amazing the pull for those. And then they get a little coupon. I had some coupons made that said, happy you're here, have lunch on us. They're $5 coupons. And I was kind of hopeful that they weren't going to have that value because they are time consuming, because you can't write the same thing year after year. So you need to know people is what I'm trying to say.
Yeah.
And
Yes.
another way that I do it is in rounding. I'll do intentional rounding on my calendar. Again, days, nights, weekends. And I do it in a few ways. So 1 month may be safety. 1 month may be on people. And then sometimes it may just be for relationship based. So I do what's called a spin to win. So it's just like a Wheel of Fortune wheel, and we'll write questions on it. And then they spin it, and they may say, what's your favorite color? If you could go on a vacation, where would you want to go? Things like that. Or they can ask me a question. I've had some tough ones that have come back, though, just so you know. But then they get, I round with a cart as well. So it's got snacks and goodies and candy and whatnot. But it's the way to build a relationship and to tie it back. That's how I build remembering who people are better, right? Because if I have an
Yeah.
experience with them, I'm an experiential
Yeah.
type of person. And then I tie that
Yeah.
back usually into their anniversary card as well. So again, trying to connect the dots. And that's an important
It's
thing.
it is pretty funny because in this time where it's like you know employees are looking for intrinsic value in the work that they do, and people are leaving places, and maybe I think last year we had the quiet quitting and the like, and everyone, you have these organizations are like, what do we do, how do we engage our folks, and it's like, look at the small act of just writing a handwritten note.
Yep.
Like, this did not cost, it is time consuming. There's no question about that. But this did not cost an organization big money. You did not have to sit down with a whole committee and plan out how that was going to happen, right? It's a very simple thing. And I like to, the mass value that you've gotten out of this very simple kind of act. It's like, of course you got to pay people living wages and all that's important, but it's this stuff. It's not, you don't have, it's not going to be a raise, right? It's this type of stuff that's going to keep people engaged and really wanting to work for an organization like yours, really wanting to work for a person like you. That's what's going to get you the good talent. That's what's going to retain top talent, in my humble opinion. But it's just facts. It is true.
And I think, as we look at our true north I talked about, and we look at countermeasures then to improve our people, it's hard, right? Healthcare's been challenging. I can guarantee you, not all of the caregivers, if you would be talking to them, would feel the same way and see all of that, right? Even no matter how hard you try. Again, relationship-based leader is important to me, and I want to see people happy with their job because I think for me, if we have engaged caregivers that feel supported, I believe then you're going to have a safer environment. You're going to
That's
have
right.
better patient outcomes, and you can kind of look at that from either side, right? So, but for me, that's definitely how I like to lead. I did starting January 1st of this year, actually add another component because we do have people leaving, and so and it's hard, and it was really hard with mass to remember names. So every new caregiver now coming in for Prineville and Madras gets a handwritten note of, I'm glad, thank you for choosing us, because it's a choice they made for us, right? And
That's
hopefully it's
right.
a choice they made that aligns with our vision, mission, and values, and our acts of excellence and what we believe in. So, and just saying thanks for coming. I really need to learn and understand your fresh perspective and what you bring. And if you need anything, to reach out to your leader or to myself directly. So again, just another simple tool to help engagement and hopefully help to build those relationships where people want to be here.
People to feel connected to you, connected to the org, and certainly connected to the beliefs. Well,
Exactly.
I don't know, Todd. This was like one of the easiest conversations we've ever
I,
had
I
because
know. I feel terrible.
you're
It's
just
dark.
so
I just
you're so dialed in. You're like so in tune with people and what they need. And obviously you can't please everybody. And it's a very, very tough business that you're in and dealing with people who really need all the caregivers. But you certainly are. This is so refreshing. It's actually really just music to our ears because we don't hear this all the time, and we hear a lot of excuses for why not. Time being the biggest one. But I think you clearly are demonstrating that you got to put the time in. You got to invest. This is where you as an administrator are needed most, and that the people at the front line know how to mostly handle the issues, right?
yeah. Well, and I think it's I thank you for those comments. I appreciate that, and I think that I also need to say it's not just me. So my one up comes out and rounds with me. Our CEO and president comes out and rounds, and that's an important piece, and I think it's modeling that behavior. Again, we're able to do it different in a critical access hospital because we're smaller, right? And I think that's where there's so much value again then to build those relationships because most of the caregivers in the communities know the patients that come in as well, right? So again,
Mhm.
just all of those connections are such an important piece in the work we do.
It also
Yeah.
seems to speak too to like small tests of change, right? Because you are able to do this on a little bit of a smaller level, but then you do see the benefits. These are just another proof point for why it does need to work in the larger hospitals. Yeah,
Well,
you
and
might need four people writing handwritten notes, but it's still can
but if
happen.
I could add, in the larger hospitals, I've worked in larger hospitals. The ones that are most effective, the ones that get the highest patient experience scores, the one that have the lowest, safety risk, the ones that are getting these great grades are the ones who are taking the time to do this. It is a little bit more challenging in a big hospital, but a big hospital still has, they have a COO and they have a CNO, and then they have their different layers that go down. So it really isn't impossible. It is the process of getting into it, I think, that is uncomfortable for everybody. Once you've got it going, it really is a system that just works good for everyone. So I'm still
Yeah.
saying this can be done no matter what size the organization is. You just have to
Yeah.
be willing to commit to the process of it.
Trust the process. Commit to the
Trust the
process.
process.
Yeah. The other thing that I think about too, what Todd's sharing is the importance of role modeling, right? If there's one thing that we constantly talk to clients about is how much influence you have in showing up how you want somebody else to show up for you, right? Like
That's it.
how you're showing up is, being that change. I say this all the time, right? The Gandhi quote, be the change you want to see. And if you continuously do that and stick to your values, showing up with, your beliefs, your North Star, and making it happen. Like, this is what people remember, you know?
And what they gravitate to, right? If it's a
Yeah,
thing that's not for them, then they're going to leave. And that's not a
right.
hurtful thing for either side. But if you
Yeah,
are committed to your values, if you are committed to what your mission is as an organization, you're committed to driving and delivering that value back to your
yeah,
patient, customer, employee, whomever,
mhm,
your
yeah,
vendor, all your stakeholders, you are going to, one, you're going to find success. There's no question about it. Two, your days are going to be easier. Your
yeah.
days
More
are
fun,
going
right?
to work
Yeah,
better.
yeah.
Yes, you're going
You're,
to have more fun.
yeah.
Yeah, absolutely.
A kinder
So
experience, be more engaged in the work, find pleasure in the work. It's not, you know, we're not, oh, I gotta show up on Monday. I'm so excited to leave on Friday.
that's right. That's right.
It's
That's
all
right.
part of the process, part of our life. That's the work life integration. Loving what you do. I do wonder how so many people, and maybe it is just, part of being a role model, show up to be accountable to solve the problems, to be accountable to bring up the issues that they're seeing. Because I think that is, I do still think that is a hard barrier for people to break through.
Well, but that's why I love what Todd said, right? It's like they create this celebration, the
Yeah,
celebration around bubbling that stuff up. It doesn't
yeah,
become a this is now your problem because you
ugh,
bubbled it up. It doesn't
right,
become a judgment because you bubbled it up. It all
yeah,
the negative stuff they've pushed to the side. They've said thank you.
mhm,
Thank
yeah,
you, thank you, thank you. All that celebration, all that creating the space where it's like we want to know this stuff and we're excited when we find out this stuff, and we're grateful that you brought this. Everyone will
yeah,
be raising their hand all the time. The reason
yeah,
people don't raise their hand in an organization is because of the things I said. Listen, I was one
yeah.
of
Now
those
it's your
people.
problem, or you get in trouble.
I was one of those people that you bring it up and then all of a sudden it's my problem to solve. And now I'm being
Right,
judged because I didn't solve it quickly
the
enough or in
way,
the right
yeah,
way
or
that
the
everybody
way,
wanted or whatever.
yeah,
So you're just
yeah,
like, you just learn to
yeah,
keep your mouth shut. So I think it really does. And I love that he was like, it's not just me. Your CEO
for
has to be
sure.
involved in
Yeah,
this. Your COO
yeah,
has to be involved in this. Your
yeah.
CFO has to be involved in.
Mhm,
Everybody needs to
mhm,
be part of this process of how do we solve problems? How are we a culture
mhm,
ready to like hear the stuff and then get the engines going to fix the stuff?
yeah,
It really is every single layer of the organization, and it's all equal. I don't even like this. It really is this because it's going to take all of these pieces and parts to connect back to make it flow the way you want it to. I believe what I heard from Todd is exactly what I've seen throughout my career in the clients that have seen success. If you want to have a successful business, you have to empower your people at all levels of the organization. You have to create the space to listen. You have to create the space to act. And by all means, you have to create the space to close the loop.
mhm,
Probably one of the best things he said, honestly. We've got to be able to close this loop, communicate back the work that's being done. I often said, even if the work can't start today, or even if there's not a solution in 24 hours or in 7 days, there's still
mhm,
a follow up. We have not forgotten
right.
about this. We are
That's
still
right.
working on this. We are still, right. So there still is
Yeah.
this. We want
Setting
to make sure we always
expectations, right? That's,
set the
that's
and
a theme
close
there.
the loop. Yep. And close the loop. So
Beautiful.
the key message, we're going to empower people at all levels of our organization. And it starts by just creating the space to do that.
Huddles and hot sheets, huddle hot sheets. Well,
Tiered
thank you
huddles.
so much. Thank you, Todd, for joining us. This was
Thank
great.
you,
And
Todd. This is
obviously,
amazing.
St. Charles and Todd's group over in Prineville and Madras are really doing amazing things. So it's wonderful to hear. It can be done. It
It
can be
can
done
be
in a very
done.
critical, fast paced environment. So if it can be done there in one of the hardest industries that we experience, it can be done everywhere.
That's right.
All right,
Thank
thanks so
you.
much. We'll see you next time on our culture chats. Thanks, Todd.